Hello friends, today we are going to discuss some important biochemistry MCQ which were asked in NEET PG 2023. There are about 20 MCQ which were asked in this NEET PG 2023 and all the topics are belong to the mostly vitamins, minerals, enzyme as well as metabolism of carbohydrate, lipid and protein. So one by one we will look the MCQ and how to select right option that we are going to discuss. So here first question is about which of the following clotting factors is needed for gamma glutamyl carboxylase. Now two things in the question, one is clotting factors and second is gamma glutamyl carboxylase. So gamma glutamyl carboxylase, when this word is there, you have to directly select that particular vitamin K is responsible for the gamma carboxylation of glutamic acid. So from your theory recall, you have to remember that gamma glutamyl carboxylase. Second thing, vitamin K is not given in question, so you have to think about gamma glutamyl carboxylase that will give hint of a vitamin K, and vitamin K is related with the which clotting factor, and that will give you the correct answer. So related to the factor and gamma glutamyl carboxylase in vitamin K, you have to remember factor 2, 7, 9, 10. So now you have to choose the which option is given factor 2, 7, 9, 10. Your first option factors 2, 8, 9, 10, which is not a right answer. Factor 2, 7, 9, 10 in option 2. Third option, that is 2, 7, then 9 and 11, 10 is not mentioning, and fourth option is 2, 8, 10 and 11. So right option is factor 2, 7, 9, 10, which is given in a option 2. So here question is based on vitamin K, but vitamin K is not mentioning in the question. So you have to choose the vitamin K based on the two hint which is given in the question, gamma glutamyl carboxylase and clotting factor. So that's why you have to choose the right option. So how to clear the MCQ? So you have to get the hint from the question, and from the question you have to identify the topic, and from the topic you have to recall all your memories. Now another MCQ, a patient presented with diarrhea, dermatitis and dementia. Here a typical scenario is given, and from the typical scenario the case is framed. So which of the following vitamin deficiency would you suspect in this patient? So in vitamin deficiency, you have to directly jump over the vitamin A, D, E, K, fat soluble vitamin B complex and vitamin C, diarrhea, dermatitis and dementia, which is particularly classical picture of a pellagra. Pellagra will occur in a deficiency of niacin, that is vitamin B3. Now another thing, whenever you are talking about vitamin B complex, you have to remember number as well as their name. So 3D syndrome, that is also called a diarrhea, dermatitis and dementia, which is 3D syndrome, which is called as a pellagra, and that is typically seen in a niacin deficiency. Niacin deficiency giving number vitamin B3. So options are vitamin B3 deficiency, vitamin B1 deficiency, vitamin B6 deficiency and vitamin B12 deficiency. So you have to directly jump the right option, that is vitamin B3 deficiency, which is the right answer. But whenever we are talking about the right answer, you have to cross check the other options. Vitamin B1 thiamine, which is related with the beriberi, which is dry beriberi or wet beriberi. Vitamin B6, no particular syndrome is given, but B6, that is pyridoxal phosphate, and that is related with the anemia and other conditions. Vitamin B12, which is somewhat related with the CNS related problem, means subacute combined degeneration. Vitamin B12 means cobalamin. So here from the diarrhea, dermatitis and dementia, you can directly jump the right option, that is vitamin B3, which is the right answer in this MCQ. Now another MCQ, which is also case based, a young boy presented to the OPD with hypoglycemia and muscle cramps on exertion or while playing. Then he becomes normal after resting for a while. These episodes are recurrent after a period of activity. He has decreased serum lactate and glucose level. So definitely hypoglycemia is there. Which of the following disease is he most likely to be suffering from? There are typical situation which is explaining the hypoglycemia. Hypoglycemia can occur in so many conditions, but here along with the hypoglycemia, other condition is written like muscular cramp while the playing or during the exertion, and also it is becoming normal after some time. Second thing, it is this episode is occurring frequently. So here we have hint about the hypoglycemia and muscular cramp. Now we will look over the different option: McArdle disease, Hirsch disease, Coris disease and Anderson's disease. Now here all the options are related with the glycogen storage disease. Now you have to remember that name of each and every glycogen storage disease and which deficiency or which enzyme deficiency related to the disorder. Now from the hint, basically hint is muscle cramp, recurrent after activity and normal after the resting. Now that four option, McArdle, Hirsch disease, Cori's disease, Anderson's disease. Now M for the McArdle, and from the M you have to remember it is related with the muscle phosphorylase. H Hirsch disease, which is related with the hepatic phosphorylase. Another option is Cori's disease, which is related with the branching enzyme deficiency. Anderson's disease, which is A, and from that you have to remember it is related with the branching enzyme deficiency. So Cori's disease for the debranching enzyme deficiency, Anderson's disease for the branching enzyme deficiency. Now from the option that only one thing is that muscle cramp, and these muscle cramps or muscle that exercise intolerance that is typically seen in the muscle phosphorylase enzyme deficiency. So right answer is McArdle disease. Now instead of that, sometime McArdle's disease it may be written about the particular enzyme deficiency. Suppose that option is not a McArdle disease, Hirsch disease, Cori's disease or Anderson's disease, it may be written as a muscle phosphorylase enzyme deficiency, or instead of that Hirsch disease it may be written as a hepatic phosphorylase enzyme deficiency. Cori's disease, instead of that it will be written as a debranching enzyme deficiency. So you have to remember both the thing, the name of disease as well as which enzyme is deficient. So from this case scenario you have to take the hint. From the case scenario you have to find out hypoglycemia, and second thing muscle cramp, and this episode is occurring frequently and that is also becoming normal after some time. So right answer in this case, that is muscle phosphorylase enzyme deficiency, which is seen in a McArdle's disease. So from the question you have to identify the hint, and from the hint you have to check your recall all the theory part, and from the theory part you have to choose the right option or right answer. Now another case based scenario, a family consumes only polished rice. Which of the following combination of vitamin deficiency and enzymatic defect will be present in this family? So here a typical case is given which is related with the typical theory part. So in the theory part, all the foodstuff that is also mentioned, from which foodstuff, from which molecule you will get. So basically it is most important for the vitamins, and when we are talking about the vitamins there is also deficiency as well as supplementation, both are discussed. So for the vitamin B complex, particularly polished rice, and that is mentioned in a vitamin B1. The name of vitamin B1, that is thiamine. Now thiamine, that is B1, the main source of thiamine, that is outer layer of the grain, means outer layer of the wheat and rice, and here typically mentioning about the polished rice. Polished rice means whenever the polishing will be done, outer layer of the rice will be removed, and that will lead to the deficiency of the or decrease availability of the vitamin B1 from that particular foodstuff. So it is directly jumping over the one vitamin deficiency, that vitamin B1 thiamine. So either it will be written as a number B1 or it will be written as the name of the vitamin thiamine. Now we are going with the enzymatic defect also. So first option is riboflavin glutathione reductase. Now riboflavin, that is vitamin B2. So you have to remember name of vitamin and number of vitamin. Glutathione reductase, that is particular enzyme which is related with the glutathione, and that is for the regeneration of glutathione molecule in our body. Now another option is thiamine and transketolase enzyme. So that is vitamin B1. Another option is thiamine and transaminase enzyme. And fourth option, that is riboflavin, again vitamin B2 and transketolase. From the polished rice we have concluded that it is related with the vitamin B1, that is thiamine. So right option will be thiamine or thiamine, that is with the option 2 or 3. Now again with the vitamin B1 you have to remember transaminase, that is related with the vitamin B6 pyridoxal phosphate, which is helping for the transamination reaction. So thiamine is not related with the transamination reaction, and transketolase, that is one of the enzyme of the HMP shunt pathway, and thiamine is also helping in this transketolase. Also one MCQ or one theory part for the vitamin B1 is that vitamin B1 activity will be measured in RBC with the help of transketolase enzyme. From that also you can conclude or you can also get the hint for the option or for the right answer. So you have to jump over the right option, that is thiamine transketolase in this question. Now another MCQ, that is a chronic alcoholic patient presented to the casualty with confusion, ataxia and painful eye movements. what could be the vitamin deficiency seen in this patient? Now, chronic alcoholic patient, so whenever the alcohol is written, you have to remember some particular condition related with the vitamins B1. Now, B1 is also related with the Wernicke-Korsakoff syndrome, that is one thing. This chronic alcoholic patient that is presented with the confusion, ataxia and painful eye movement and vitamin deficiency. Now, here vitamin B deficiency, that is option. Vitamin A deficiency. A deficiency is related with the vision, but for the rods and cones. That is also related with the night blindness and total blindness. Vitamin D deficiency that is directly related with the rickets, osteomalacia, and vitamin C deficiency, which is related with the collagen fiber and scurvy. Okay, but here the only option we can, if it particular number is given, then we can choose particular vitamin B1. But here particularly alcoholic patient presented and broad option is given like B, A, D and C vitamin, so you can easily choose the option of vitamin B deficiency in this case. So in this case, the easy thing is that ataxia, painful eye movement, confusion, all are related with the Wernicke-Korsakoff syndrome, which is related with a vitamin B1 deficiency or thiamine deficiency. So right option is vitamin B deficiency. Now another case, that is another MCQ. A 4-year-old child present with easy fatigability. The mother also complains that the child has increased hunger between meals, which is relieved after food. Liver examination revealed no glycogen. The enzyme most likely deficient is. Now here question is about which enzyme is most likely to be deficient in this case. From the age 4-year-old, one thing. Second thing is that the complaint is in between the hunger, that is mostly hunger related, and that is hunger between the meals. So from lunch to dinner, in between that hunger is there, and whenever the food is given, it is relieved. And another most important hint, that is no glycogen. So no glycogen means it is not directly written hepatomegaly. Glycogen that is stored in the two sides in our body. Glycogen mostly stored in the liver and muscles. So when excessive glycogen, then it will lead to the glycogen storage disease, and that is mostly glycogen storage disease is mostly related with the hepatomegaly, but not in each and every case. So you have to remember which glycogen storage disease is not related with the glycogen hepatomegaly. So here particular hint is no glycogen, means glycogen is not present in the liver, which is find out in the liver examination. Now options are glycogen phosphorylase. Now glycogen phosphorylase related to that two things that already we have discussed, hepatic phosphorylase and muscle phosphorylase. Both are related phosphorylase enzyme, basically related with the breakdown of the glycogen. Another, that is glycogen synthase, which is helping for the formation of the glycogen. D-branching enzyme, that is also for the glycogenolysis, means breakdown of the glycogen, that is D branch. Whatever the branch which is remain in the glycogen, that will be broken down with the help of D-branching enzyme. Another option, that is glucose 6-phosphatase. Now this enzyme glucose 6-phosphatase, that is the last step of the gluconeogenesis, means glucose 6-phosphate to glucose formation, that is possible with the help of glucose 6-phosphatase enzyme. Now glucose 6-phosphatase, that is related with the von Gerich disease. D-branching enzyme, that is related with the Corich disease. Glycogen synthase, that is required for the glycogen formation. Glycogen phosphorylase of two variety, hepatic and muscles, that will deficiency lead to the myocardial disease. Glycogen phosphorylase enzyme, hepatic variety, if it is deficiency, heart disease. So from all that, now you have to conclude. Now no glycogen in liver, that is the main hint, but phosphorylase is basically purpose for the use of glycogen, but glycogen is not present in the liver. So basically there is a hunger in between the meals, because glycogen is basically not remain in the liver, which is available and which is mostly providing the glucose in between the meal, means in between the meal we are getting the energy from the glucose, but this glucose is available from the glycogen which is stored in the liver. Now liver is not able to store glycogen because glycogen is not produced in the liver. Why glycogen is not synthesized? Because which enzyme is required for the glycogen formation? Glycogen synthase. And so most likely option, that is glycogen synthase. Now another thing is that D-branching enzyme and glucose 6-phosphatase both are related with the mostly hepatomegaly. And glycogen phosphorylase, that is deficiency is not likely, because glycogen phosphorylase, that is mostly related with the hepatic and muscles, and that both are related with the once glycogen is stored and that is not able to utilize. If glycogen phosphorylase synthase is deficient, then glycogen will be remain deposited in the liver. That is also indirectly thinking that glycogen will be present when we are examining the liver. So from all these things, we can conclude the right option, that is glycogen synthase enzyme deficiency is likely in this condition. So from all the options, you have to think all the theory part, and from the theory part, you have to finally conclude which option is that. Now, another question, case based. A child was brought with pedal edema and chiliosis. Cardiomegaly was present. What is the vitamin deficiency associated with this clinical presentation? Now, a case based, a child is there, particularly pedal edema and chiliosis is written. Cardiomegaly was present. Now, whenever the cardiomegaly means it is related with the cardiovascular system. Now, cardiovascular system related symptoms are also present in vitamin B1. Now, another that is diverting point, that is chiliosis. Now, this word chiliosis, glossitis, magenta color tongue, that particularly written in a vitamin B2. Now, here in the question, cardiomegaly is written and pedal edema. So more related with the cardiovascular symptoms are there. So we cannot divert for only one thing, chiliosis, and so we have to look over the different option. So riboflavin, that is vitamin B2, which is given as the first option, which is mostly diverting for the chiliosis. Second, thiamine, that is B1. B1 deficiency lead to the beriberi, that is also of two variety, wet beriberi, dry beriberi. Wet beriberi for the CVS, cardiovascular system, dry beriberi for the CNS, central nervous system. Pyridoxine, that is vitamin B6 deficiency, which is related with the anemia, convulsion and different condition. So pyridoxine, vitamin B6. Niacin, which is related with the pellagra 3D syndrome, that is diarrhea, dermatitis and dementia. But here two things, pedal edema and cardiomegaly, and both are related with the cardiovascular system, which is more related with the wet beriberi. So right answer that related to the wet beriberi, that is thiamine. So here the right option, that is thiamine, vitamin B1 deficiency. Now another thing or another MCQ, that is a chronic alcoholic patient is diagnosed with gouty arthritis. What biochemical changes will be seen in this patient? So another thing, chronic alcoholic, that one situation is given related to the patient, that is alcoholism. Second thing, gouty arthritis. When the gout is there, you have to directly remember that two causes, primary causes, secondary causes, primary condition, secondary condition. Now biochemical changes related to the alcohol, directly alcohol metabolism. Whenever the alcohol metabolize, one thing, that NADH level will be increased in cytoplasm as well as in the mitochondria. So these are the basic thing related to the alcohol. Gout means uric acid level is increased. Gouty arthritis means pain surrounding the joints will be there. First, metatarsophalangeal. Now which are the option? Decrease NADH NAD plus ratio. So what biochemical changes will be seen in this patient? Decrease NADH? No, NADH will be increased because that alcohol is metabolizing. Increase urea and urate level? Yes, urate level means uric acid level will be increased, but urea is not affected. Increase urate and lactate level? So this will be likely the right answer, because urate means uric acid level is increasing, because there is only the condition is gouty arthritis. Lactic acid is also likely to be elevated because NADH level is high in alcoholic patient. In alcoholic patient, this NADH will lead to the diversion of pyruvate to the lactic acid in an anaerobic metabolism. So whatever the glucose will be metabolized, pyruvic acid will be generated. Already NADH level is high, so pyruvate will not diverted to the Krebs cycle. So the remaining pyruvate that will be diverted to the lactic acid formation. So lactic acidosis is also a case of a alcoholic patient. So alcoholic patient, due to that lactic acid will be elevated, and due to gouty arthritis uric acid level will be elevated, and that's why you can choose the right option. But we will look the another option, that is increased level of alkaline phosphatase. Totally irrelevant option is there. Alkaline phosphatase, that is totally related with the obstructive jaundice or the bone related condition. So here the right option, that will be increased urate and lactic acid level. So you can choose the right option 3 as the answer of this MCQ. Now another MCQ, a child present with erythematous scaly patches in the perioral region, mucosal ulcers and impaired epithelial wound healing. The most likely mineral deficiency associated with this condition is. Now with the minerals, some condition that you have to remember related to the copper, it is related with the wound healing, that is one thing. When we are talking about the iodine, that is goiter. Zinc, that is related to the zinc, two words that you have to remember, perioral and perianal region, and these region are typically related with the zinc. Zinc is also associated with the so many enzymatic activity. But these are the typical situation that you have to remember. Here typically written child present with a erythematouscaly patches in the perioral region. Perioral region, you can directly jump to the one particular vitamin mineral that is in your mind. Perioral or perianal region, you can think of the zinc. So we will look the option iron deficiency. In iron deficiency they will be mentioned about the somewhat anemia. Zinc deficiency, it is most likely the option or right answer. Calcium deficiency, nothing mentioned about the bone or calcium related condition. So everything is related with the perioral region, mucosal ulcer, impaired epithelial wound healing. Another thing, copper deficiency. Copper deficiency is more related with the particularly wound healing or collagen formation or epithelial or vessels related condition, bleeding gums or like that. But copper deficiency, nothing written about the Wilson's disease or hepatic condition. Everything is written about the perioral region, mucosal ulcer and impaired epithelial wound healing, and all are going to the one option or one right answer, that is zinc deficiency. So from the option and from the question you have to choose the right answer. Now another MCQ, a patient presenting with bleeding gums and easy bruisability was diagnosed with scurvy. So here the directly hint is given, that is scurvy, that is vitamin C, and that vitamin C deficiency related condition that you have to recall, and that is due to, now option is why it is occurring, why that bleeding gum and easy bruisability is occurring. Low calcium, so low calcium is not related with the bleeding gum. Another thing, defective collagen formation, it most likely the right answer, defective collagen formation. Other option like inhibition of the clotting factor. Clotting factor, that is totally related with the vitamin K. Vitamin C, vitamin C, scurvy related, not a condition for the clotting factor. Another thing, increased keratinization of epithelium, that is totally related with the vitamin A. So here already hint is given like scurvy, easy bruisability and bleeding gum, all are going to the scurvy. And vitamin C directly you have to remember, it is required for the maturation of collagen fiber by hydroxylation of proline and lysine. So vitamin C, ascorbic acid, scurvy, bleeding gums related with the collagen fiber in that also hydroxylation of proline and lysine, all are going to the choosing the right option, that is defective collagen formation. So here the right option is defective collagen formation. Now up to here we have discussed total 10 MCQ which were asked in NEET PG 2023. Rest of the 10 MCQ that we will discuss in another video.